Welcome to this tutorial on a new provider enrolling in Medicare via PECOS. In this video, we will learn how to complete an internet-based PECOS application for new providers reassigning benefits to an organization. By following these step-by-step instructions, it will help to avoid delays in application processing. The information given in this training is correct as of the date of publication. The most current information contained in this presentation can be found on the Noridian Medicare website and the CMS website at the links listed on this slide. If the provider does not have an approved existing enrollment in the state they're enrolling in, the Create Initial Enrollment application will be utilized. The Create Initial Enrollment Application button will create a CMS 855I application, which includes the reassignment topic being completed within the application to reassign benefits to the organization. When completed, it allows the provider to be set up as an individual and for that organization to receive reimbursement for the services they render. Navigate to PECOS and log in. On the PECOS Welcome screen, select My Associates. On the My Associates page, select Create Initial Enrollment Application. The first portion of the application questionnaire is applicant identification. Select which provider the application is for and click Next Page. If your provider isn't listed, then you have not received approval from the INA. Approval is necessary to submit an application as a surrogate. The next question will ask to select the option that best represents the healthcare services rendered for this application. Since the intent of this video is to instruct on how to reassign benefits to an organization, select Individual Physician or Non-Physician Practitioner and click Next Page. The third question will ask about the enrollment scenario. For a provider reassigning to an organization, select the Group Member Only option and click Next Page. The fourth question will ask to confirm the provider's identity. If it is correct, click Next Page. The fifth question will ask to identify the state for the enrollment. Select the correct state and click Next Page. The sixth question will ask to identify the provider's specialty. Click on the appropriate drop-down list and select the provider's specialty. Then click Next Page. The seventh question will ask whether the organization is already enrolled. Select Yes and click Next Page. The final page of the questionnaire is a brief overview of how the questions were answered. If all the information is correct, click the Start Application button. The starting page for the application will contain 3 tabs, which can be used to navigate the various sections of the application. To begin completing the application, click Personal Information. In the Personal Information topic, click Add Information. The Edit Name button can be used if the provider's name needs to be updated. Indicate whether they are accepting new patients. Then click the Next Page button. On the Other Name for the applicant page, indicate whether the provider has an other name. Select Yes if there is any information to report here. Otherwise, select No and click Next Page. On this page, select the provider's medical school or other professional school. A non-physician specialty should select the Other option. Enter the year of graduation and then click Next Page. Select the appropriate IRS status, either proprietary, nonprofit, or disregarded entity. Then click Save. Review the basic information provided. If anything is incorrect, go back and edit it. If not, click the Next Topic button. The practitioner specialty topic is a review page to verify that the specialty being enrolled is correct. If the information present is correct, click the Next Topic button. If it isn't correct, you will need to discard this application and start over. The reassignment topic is where information for the organization receiving the reassignment of benefits is added. Click the Add Information button. Select whether the entity the provider is reassigning to is an individual or an organization. Click Next Page. Enter the effective date of the reassignment. Please note that this date cannot be more than 60 days in the future from the day the application is received. If the effective date listed is more than 60 days in the future, the application will be returned to you. Enter the organization's legal business name, their tax identification number, and the NPI of the organization. The name should match what is found on the IRS document and the organization's Medicare enrollment. The NPI needs to be 10 digits. If the organization has more than one NPI for the same tax identification number, only list one of the NPIs for that organization. It is not required to enter more than one NPI. Click Next Page. Enter the Medicare identification number for the organization. The Medicare identification number should include all preceding numbers and letters. If the organization is new, they may not have been assigned a Medicare ID yet. If not, enter pending into this field and click Next Page. If the organization has more than one group Medicare ID, select the Add More button and complete for all applicable group Medicare IDs. This page asks the user to select a primary and secondary practice location. Select the appropriate addresses from the drop-downs. When finished, or if choosing not to select a primary practice location, click Save. On the reassignment information page, if the provider needs to add a reassignment to another tax ID, select Add Information and repeat the steps, starting with the reassignment type. If all the information has been added, click the Next Topic button. The next topic is correspondence address. Click Add Information to enter the mailing address of the provider. The address listed here must be one where the provider can be contacted directly. It cannot be the address of a billing agency, management service, organization, chain home office, or the provider's legal representative. Once completed, click Next Page. The next page asks if the medical records correspondence address is the same as the correspondence address. If they are different, enter the address and click Save. Select the closest address match to USPS as possible. If USPS cannot verify the address, an explanation of why the address cannot be verified will need to be supplied. After reviewing the correct information, click Save. Another summary page will appear. If all the information on the correspondence address review page is correct, click the Next Topic button. On the Next Topic page, enter all the applicable providers' licenses, certifications, and DEA information. For each one, select Yes. Click Add Information, identify the type of document, and enter the information for that document, and click Save. Once all documents have been added, click the Next Topic button. Verify your information is correct and edit if needed. Go to Next Topic. For final adverse legal actions, answer if the provider has any legal history. If there is nothing to report, select No and click Next Topic. If there is an action to report, select Yes and click Add Information. Enter the final adverse action information and click Save. In the Organizations with Ownership Interest and/or Managing Control topic, select No and click Next Topic. In the Contact Person topic, add information for all the contact people. This information will be used for correspondence in case any corrections are needed to the application. Click Add Information and follow the prompts. Failure to respond to a request sent to the people listed in this section could result in the rejection of an application. The individual completing the application will be listed automatically. Click Edit and complete the information. Once complete, click Next Page. Review the information. If any corrections are required, select Edit. If everything is correct, click Review Complete, followed by Next Topic. Decide what documentation you need to submit. Expand and check out the checklist. Choose Upload for method of delivery. Save your checklist. Then scroll to Step 2. Select either Upload Now or Later. Uploading now will allow faster processing of your application. If you chose Yes, Step 3 will drop down. Select the type of document you are uploading. Browse for your document and click Upload. Your screen will display a list of all the documents you have uploaded. Once completed, click the Return to Topic button. Check the error warning page for any items that may need to be addressed. If there is a yellow error indicator and the reassignment topic is listed, this is because a primary practice location was not supplied. A primary practice location is not required, so the application may be submitted. Select Reassignment if you would like to add a primary practice location, or click the Begin Submission button. Select the name for the authorized signer of the organization listed in the reassignment topic and click Next Page. The easiest way to submit signatures is through an electronic signature. Select the electronic indicator and each selection will give a drop-down to complete. Enter the appropriate email address for the organization's signer. If submitting on behalf of the individual provider, their email needs to be added under their name. E-signers receive an email from CMS indicating they have an application that needs to be signed. If the provider is submitting the application, select Sign Now and click Next Page. Click on Penalties for falsifying information and scroll through to the bottom. Then select Authorization Statement and scroll through to the bottom, which will then allow you to click on the Accept the Terms and Conditions box. Accept the terms and conditions, then click Submit. On the next page is Contact and Processing. Choose Noridian Healthcare Solutions as your fee-for-service contractor. Scrolling down will show you a list of required documents, and if signatures are still needed, click Apply. If the application is electronically signed, there is no need to submit paper certification statements. Once you've reviewed the page and are ready to submit, click the Complete Submission button. Once your application is submitted, a pop-up box will appear indicating successful submission. Click OK. The page should now say Submission Complete. Print and save this page and it will have information that will allow you to track your application. Here are some things to remember. Application status can be monitored from the My Enrollments page. If the application is returned for corrections, 30 days are allotted for the corrections to be made. All signatures must be submitted for processing to begin on the application. Remember to upload the required documents as a PDF to avoid additional processing time. Thank you for taking the time to listen to our tutorial. Continue your learning experience by referring to additional recordings available on the Noridian website or our YouTube channel.